acupuncture for carpal tunnel syndrome. And remember, when we talked about the anatomy of the carpal tunnel, there are a lot of structures packed into this really tiny space. So you want to be as cautious as possible to not touch the median nerve with your needle. And a nice way to really help position your client properly is we're working with the pericardium channel here. So you can place a towel or a bolster or any sort of support underneath the wrist so that the wrist ends up in flexion. And I like to use these fascial needles just because they are, nice and smooth and a little bit, thinner and a little bit more gentle here. And just because you just really want to warn your client, we're not going for this nerve and we don't really want them to feel a lot of strong nervy pain here. But chi sensation, that's another story. So it's okay if your client feels that. So you'll begin about 1/2 of an inch proximal to the wrist crease. So we're going up here about 1/2 of an inch. And you're going between the tendons of palmaris longus and flexor carpi radialis. And you're going to avoid any noticeable veins, arteries, anything like that. You're not needling into those structures. You'll do a transverse insertion. And you want to place the needle as close to the top of that tunnel as possible without touching the tendons, without touching